Welcome everyone to Healthy Kids the Easy Way, a simple and stress-free action plan to get your kids eating right and building great health for life. Now we've got a very special interview today. It's going to talk about some special needs and some concepts that you might not have heard about before, but stay tuned because I promise you there's going to be amazing information in here for everybody. So I'd like to introduce Dr. Erica Peirson, and she's a naturopathic physician who specializes in a functional medicine approach to helping children with Down syndrome, autism, and other special needs. She lectures worldwide to educate other physicians and parents about the many ways to optimize the health and cognition of these children. She also helps patients from all over the world through telemedicine and in person at the Peirson Center for Children in Portland, Oregon. She is the mother of a healthy 11-year-old son who has mosaic Down syndrome. Well, thank you, Dr. Peirson, for being with us today. This is quite the pleasure.
Thank you so much for having me.
Thank you. So I'd love for you just to tell the audience about the work you do, maybe a little bit about your story and how you came to do the work that you do.
Yeah, absolutely. So certainly it began with the birth of my own son. And when I brought him to physicians, and my experience early on quickly told me that the information that's available to physicians was limited. And when I asked them about the very topics that you're looking to promote here, the benefits of, lifestyle, diet, supplements, I was met with a bit of a wall, of course, that they made no difference. And so, so I started looking very deeply into the genetics of this extra chromosome that was perhaps affecting my son. So where I started was, around the area of genetics. And then, over several years, started to learn that it was really where I was helping my patients was beyond the genetics, right? Looking beyond the genetics and helping them with, again, what you're promoting here today. So my story started with my own son, and he just, as he grew older, was thriving, was absolutely thriving. And, his diet was very clean, and I used some supplements. I didn't do quite what I do now with my patients with my son then. And felt like his diet was a huge part of why he was doing so well. Yeah.
So you really focused on diet, supplements, and just trying to address some of perhaps the imbalances caused by the extra chromosome through diet nutritional principles.
Absolutely. Yep. Yeah, absolutely. Yeah.
Wow. And that's quite a different concept today. I mean, I know a lot of people, back in the 40s, very sadly, children with Down syndrome were just put in institutions for their entire life, and no wonder they didn't do well. Nobody does well in an institution. So now the treatment has changed considerably, hasn't it?
Yeah, I couldn't agree with you more. I mean, you take any child and put them in that, an institutionalized situation, and of course they won't do well, and they won't be healthy, and they won't thrive. And so, nowadays, the expectations for our children with Down syndrome are being raised. Much of that work is being done by the parents. A lot of society and even the medical community has a lot to learn from what parents are saying in terms of what to expect of their children. And so, so even the medical community has a lot to learn in terms of how to help these children. So we have a long way to go, right? Which is why I'm speaking today. But it's certainly a much better situation than what you speak of many years ago.
Yeah. You're right. The parents are amazing. And the Down syndrome, my son has a rare syndrome as well. And the Down syndrome community was one of the first places I turned to look for some of these answers. And it's really just extraordinary how they're blasting through all previous expectations. They're discovering new ways of helping these kids. And these kids really are thriving amazingly. Can you give us a little bit of information just about what you see and how amazingly well these kids are doing from what we previously thought was possible?
Yeah, absolutely. So, what I want to start with, though, is to not sugarcoat it, right, as well. Sure. Right? There are some children who are struggling, right? So I do want to start there for just a moment. But when I hear about these children with any genetic condition, Down syndrome certainly being an area that I specialize in, when I hear about a child who's struggling a bit more with Down syndrome, my answer to that is that's not Down syndrome they're struggling with. There's something else. There's something else that the doctors are missing. And so, so when we find that something else, when we find that something else, that's where we see that children often are thriving. And look, it's not often an overnight thing. Sometimes it is. Sometimes we get quick responses. It's a bit of a journey, of course. Especially when there are things that were missed for several years in children that we work with. And so, so when we do find these things that are kind of beyond their genetic condition, and we remedy them as best as we can, yes, they can absolutely thrive and learn and be included in school and be contributing members of their community, and get jobs and even get married, and some are going to college on their own merit, full, academic college. And so when I look at individuals like that, like I just mentioned, who are getting college degrees, one of my favorite individuals is Pablo Pineda. He's in Spain. He's really fun to watch him speak. And when I look at individuals like that who are adults and thriving, that to me that's what's possible with Down syndrome. And when you look at the spectrum of individuals with Down syndrome and their abilities and their health and cognition, and the individuals who maybe are not as thriving or able to go to college or whatnot, those are the individuals that there's something that's being missed, something else, right, is going on, whether it's a gastrointestinal issue that's being undetected or hypothyroidism that's being undetected. And so to take that a little bit further, leads me to the concept of diagnostic overshadowing. These individuals with Down syndrome are often getting other medical conditions missed. I don't fault doctors for this, but they're not trained to understand that these children can be healthy and happy and thriving. So they will often miss things because they expect ill health, because that's what they've been trained to expect. And so this concept is called diagnostic overshadowing. And it's a phenomenon that occurs almost every single day. We hear stories of children who have many things have been missed in their medical history that are sometimes a bit shocking, actually, to me. Makes our job easy in a way, because we can pick them up very quickly. And so this concept of diagnostic overshadowing to me is one of the biggest things that that affects so many individuals with Down syndrome. Yeah.
So just to clarify for people at home, diagnostic overshadowing is the child has another condition, but because they've got a chromosomal condition, Down syndrome or whatever it might be, the doctor goes, oh, that's normal, or like a thyroid problem. That's normal for kids with Down syndrome, rather than treating the thyroid problem, which is what you would do for any other child, right?
Yeah, absolutely. So we hear that term, we always say that that's just Down syndrome. No, that's not Down syndrome. And so many physicians we hear from around the world will not treat hypothyroidism in a child with Down syndrome until their TSH reaches 10 or above. And for those who are watching, a normal TSH for hypothyroidism, optimal is, let's keep it simple, is around 2, right? And as we get higher, the higher the TSH goes, the more the person is experiencing hypothyroidism. So they just expect it. They expect a high TSH in Down syndrome. And so in our experience, that is one of the number one interventions that we have found, is that when we do treat hypothyroidism, sometimes with medication, sometimes not, that's where we do get pretty quick turnarounds in their health. Yeah.
Right. Yeah. No, it's an amazing one. And anyone who's ever had a thyroid condition knows that when your TSH is optimized, you feel great. You think clearly. You're functioning. But when your TSH is out, like your thyroid's out, you feel terrible. You're groggy. You're tired. You can't think. I mean, I have a thyroid issue, and that's what I noticed. So how much more for these children who are struggling with all these other things as well. So that's wonderful that you're finding these things and treating them and not ignoring those details. That's brilliant.
Yeah. Thank you. Yeah. One of our mottos here is to see the child as a child first. And for a moment, for quite a bit of our appointments, we suspend or ignore the fact that they have Down syndrome, and we see them as a child first, right? And if we can ignore that, it's tricky, right? If we can ignore that they have Down syndrome and see that what's in front of us is a child who maybe isn't growing, maybe is constipated, maybe has dry skin, right? Any typical child, you know, the doctor would be on that, trying to figure it out, we would hope. But with Down syndrome, it's just expected. So, yeah.
Yeah, no, definitely. Even for my son, it was like, oh, you know, he's got low body weight. Oh, that's just normal. The digestion, can we work on his digestion? Oh, that's just normal for his problem. So they don't even want to look at it. So yeah, it can be very, very frustrating. You're trying to optimize the health of this child, and it gets ignored because there's a syndrome overlying it.
Mm-hmm.
Yeah.
Yep.
Okay, that's brilliant. Thank you. And so, what is your treatment plan? Your approach to these children? How do you deal with all of this? What's your method?
Yeah, it's we do have a bit of a system. You know, it can get complex pretty easily, pretty quickly. But digestion and diet, first and foremost, are key for all of us. And then particularly for a child with an extra chromosome or some other genetic condition, we want, as I often say, all of our I's dotted and our T's crossed, right? We want everything as optimal as possible. And digestion for sure, and diet for sure. You know, we all would benefit from an optimal diet. But I feel in a child with a genetic condition, we really want that optimal as possible. And so, you know, so diet, right? That includes whole foods, little to no processed foods, lots of cooking at home, lots of vegetables, healthy grass-fed meats, healthy fats, as few grains as possible. Sometimes, we will recommend gluten-free oats, but diet is a huge piece of what we do. And then assessing digestion, right? I cannot emphasize how important assessing digestion, and we go into great detail here. We will ask for pictures of bowel movements if appropriate. I mean, we really want to see every aspect of digestion as we can. And we run tests, of course, to assess digestion. But if a child does not have optimal digestion, is not absorbing their nutrients properly, or has some sort of gut flora issue that is affecting their biochemistry and their brain health, that's huge. And so we want to try to pick these things up. And again,
there we go. Sorry, little brief technical glitch there. Back to you, Dr. Peirson. You were talking about digestion.
Yeah, so, digestion is complicated. There are many pieces to digestion. We've got stomach acidity and gallbladder health and, pancreatic enzymes. But one of the biggest areas, well, it's hard to say one of the biggest areas. One of the areas, that many children with Down syndrome and other children with, genetic conditions that are also experience low muscle tone, right? Uh-huh. That can greatly contribute to slow gut motility, right? And this is a really important concept that I share with as many people as I can, that the gut is a muscle, right? I don't know how people picture the gut. It certainly has a specialized lining for, secretion and absorption, and there's some specialized tissue there. But overall, the gut is a muscle, right? And so if we have a child or a person with low muscle tone in their skeletal muscles, the root cause of that low muscle tone in their skeletal muscles can also be contributing to low muscle tone in their gut. And so if we have low muscle tone in our gut, then we're going to have delayed gut motility, and delayed gut motility can lead to the little bloated bellies, right? And a backup of bacteria in the small intestine, something called small intestinal bacterial overgrowth. It's called SIBO, that some people may have heard of. And so if that bacteria in the small intestine gets backed up, and overgrown, then it will inhibit, absolutely. I could pull studies right here on my desk that show that SIBO in children inhibits nutrient absorption, growth, and then if we're inhibiting nutrient absorption, we're inhibiting cognition and, and everything else. And so, so muscle tone, low muscle tone contributing to slow gut motility. So we do what we can to, again, go as deep as parents are able to look at mitochondrial function. Mitochondria make energy for us from our food. And if our mitochondria aren't working well, we're going to have low muscle tone. If our nervous system isn't fully optimized, right? Because again, the gut is a muscle. And because it's a muscle, it's dependent on the nervous system to make it work, right? And so just by assessing peripheral nervous system, we do fairly as in-depth as we can in our children, nervous system checks. And if there's something off with their nervous system, which is often the case, that's going to impair gut function. And so, so again, we do everything to optimize the nervous system, gut motility, and assessing how it all works together. Yeah. So these are some important concepts. Yeah, for sure.
They are important concepts, and they're important really for all children because, it doesn't matter if you're eating the best diet on the planet and having the best supplements. If you're not able to absorb that or digest that, you're not going to get the benefits. So digestion for all kids is a really important thing to look into, especially if there's behavior or other sort of issues. And the nervous system. So we've had we've got a gut health expert and chiropractors talking about the nervous system. But these are huge issues for all kids, and especially kids that essentially have a little bit more of a struggle getting to where they're going.
Yeah, absolutely. And so, when you mentioned your diet can be optimal, you can be taking supplements. We do have, many families come to us and they're already giving their children multiple supplements, which we're not huge fans of. We don't like, throwing the kitchen sink at children. We really want to assess exactly their individual needs. But if you're giving your children a specialized diet and supplements, you want to make sure that it's being absorbed properly. Yeah.
Okay. And so what are some of the interventions that you've used or that have resulted in the best outcomes for children?
Yeah, absolutely. I already talked extensively about diet and digestion, but also one area that we look at fairly closely for our population of children, but this applies to every child too, is glucose metabolism. I could talk for quite a while about glucose metabolism, and you might be, you and your viewers might be thinking about, well, diabetes. Well, not everyone has diabetes. We're talking more about individuals without diabetes, but glucose metabolism for all of us. And so when I'm talking about glucose, I'm not just talking about sugar and candy, because some people might think, well, I don't give those things to my child, but even just, I have an apple here, even just an apple, I happen to have an apple here, even just glucose from your fruits and vegetables, how our body metabolizes and uses that glucose is hugely important for the brain, because the brain uses 60% of your glucose consumed. If I take a bite of this apple, 60% of it is going to go to my brain, right? And if I'm not metabolizing that glucose properly, that glucose will be stored in the form of triglycerides, and we get a little bit of extra weight, right? And so the importance of glucose metabolism to the brain is huge. So this is an area we look at closely in our population of children, and involves a lot of some in-depth biochemistry. It's more than just insulin, right? Okay. B vitamins, very important for glucose metabolism, as well as magnesium. Right. And so one area that I've seen optimize one specific B vitamin or two that I've seen that we do get some pretty quick overnight turnarounds when children are deficient in it is thiamine. Thiamine is B1. Yeah, thiamine is B1. I have a whole questionnaire on my website about thiamine deficiency. given the amount of sugar that, maybe not your audience, the children you're watching, but maybe, right, the amount of sugar that we are exposed to is just unprecedented. Even in a healthy diet, right, there's a lot of hidden sugar. And so the body is just not equipped to handle the load of sugar that children are exposed to today, especially if it's an empty calorie. And an empty calorie means, glucose that is consumed without the vitamins and nutrients that are needed to metabolize that glucose, and you will just deplete yourself even more. And so, so this is an area that I've studied for quite a bit. And when we can optimize this as best as we can, we do see some changes and some improvements. Yeah.
Wow. Yeah. No, sugar is just such an important topic, and you're taking it even further to looking into how they actually metabolize it and how they use it. And yeah, no, that's great. It really does make a big difference. Yeah.
Yeah. Trying to. Yeah.
And so just getting back to Down syndrome for a minute, do all kids with Down syndrome experience the same health problems? How does...
Yeah, that's a good question. We, one of the important things I feel that we do is to look at each child as an individual, right? And so, which not only do parents appreciate, right? I don't say it just because they appreciate it, but it's true, right? Their child is so much more than that extra chromosome. It doesn't define who they are any more than you or I having brown hair defines who we are. It's just part of who we are. It doesn't define us, right? And so, so we see them all as individuals. There certainly are certain risks, right? That many children with Down syndrome, they're at an increased risk for hypothyroidism. So our radar is a little bit higher for that. There is an increased rate of, gut motility issues and gastrointestinal issues, autoimmune conditions. So certainly there are, many conditions that they are at an increased risk of having, but not all of them, right? So because not all of them, we have to see them as individuals. And this is where we use functional medicine testing, in-depth testing to assess each child's individual needs. And there are some protocols out there for children with Down syndrome that we don't follow, we don't necessarily believe in, because we believe very strongly in their biochemical individuality. And there are many studies to support that their phenotype, which your genotype is your genetics, right? And your phenotype is how you're actually presenting. And so there's a lot of research to support that, the phenotype of children with Down syndrome varies, right? You get a room full of children, which is really fun and lovely, with Down syndrome, and you will quickly see that how different they are. They're not all the same. And honestly, Melissa, I think to me, it's almost a little bit insulting to say that they're all the same, right? I would be insulted if I was thought of as that I was just like all women. It's a stereotype, and so so we see them all as individuals, and we take their history and their case, and their treatment plans are all. None of my treatment plans are identical. There are some things that we, fish oil, things that we, commonly do recommend, but they're individuals for sure.
Yeah, I was being a bit cheeky asking that question, but because I know that that's what you do. You're very specific in looking at the individual, and that's almost another form of that diagnostic overshadowing that you were talking about. It's like, oh, they've got this condition, therefore they're all the same. No, right? We're all different, and every child needs that individual perspective. So, yeah. But within Down syndrome, there are higher rates of like hypothyroidism and Alzheimer's, for instance. Can you talk a little about those?
Yeah, so they're related actually too. Hypothyroidism is an area that where I, again, kind of started early on studying very in depth hypothyroidism, the biochemistry around that. It's a complicated process within the body, thyroid hormone, and how it works. And if there's a misstep in any step along the way of hypothyroidism, we have, if there's a misstep in any point along the way of thyroid hormone function within the body, we get hypothyroidism. And so there are many steps to study. So I do look very in depth into thyroid hormone function, looking further than, maybe conventional labs would look at, just a TSH, maybe a T4 if you're lucky. We look at T3, reverse T3, thyroid antibodies. I look at clues within a CBC and ferritin and beyond, to detect, is this child experiencing hypothyroidism or not? Again, my radar is set pretty high for that. But that relates to Alzheimer's, right? The rate of Alzheimer's for individuals with Down syndrome has been estimated to be 100%, right? That by the time they reach 35 or 40, 100% of individuals with Down syndrome will experience Alzheimer's.
Which is terrifying for parents. Yeah.
It certainly can. Yeah, it certainly is. And so we start pretty early at preventing Alzheimer's. Here's the thing. So there's a genetic cause for that. The current theory around Alzheimer's is that it's caused by these amyloid plaques within the brain. Okay. And the gene that makes these plaques, it's called amyloid precursor protein gene. That gene is on chromosome 21, right? So a lot of the research is centered around this gene, right? But there's also research, there's current work being done by, his name is Dr. Dale Bredesen. I'm a huge fan of his. I'll plug his book a little bit. He's written a book called The End of Alzheimer's, and he is reversing Alzheimer's, which isn't being done by the pharmaceutical industry. He's reversing Alzheimer's in individuals using diet, lifestyle, coconut oil, preventing sleep apnea, checking homocysteine levels, right, B12, right, using this multifactorial approach, because Alzheimer's, like Down syndrome, like many conditions, is complicated and multifactorial. So if a condition is multifactorial and complicated like that, you need a multifactorial approach to it. You can't just target in on the gene and try to correct it in that way, or just throw your hands up and say, well, their gene is there, why should we bother preventing it? But there's a lot of research to support other means to supporting brain health and preventing Alzheimer's, like thyroid hormone, right? Hypothyroidism has been linked to Alzheimer's, as has many, various, conditions and health problems. So a complicated condition needs, I don't want to call it a complicated approach, but a multifactorial approach, yeah, which is lifestyle, diet, right, et cetera.
And more that idea is coming into the mainstream with all health. It's like, okay, instead of just going and trying to get a pill for whatever your symptom is, it's like, look at the whole body. And thus the popularity of health coaches these days, because it's diet, it's lifestyle, it's stress, it's everything that you do in your life, and just working on getting that to a much more, a much better balance, essentially. It helps everybody flourish, really, doesn't it?
Yeah, absolutely. And so having the health coach, like you said, is really helpful. Someone like myself, I do a lot of, the biochemistry, and I recommend supplements. I don't have time to, kind of handhold and walk them through the diet. I have just time to send them information about it, hope they can do their best. So having some help from some other means is often, nice for families. And then I quickly don't want to underemphasize the point of exercise too, when we talk about lifestyle, and the role that has in just oxygenating the brain and keeping the body healthy. And again, it's something that, we could argue that children aren't getting enough of. We're indoors more, playing video games and TVs and things. So when we talk about diet, lifestyle, exercise needs to be in there as well. Yeah.
Definitely. I'm finding what you're saying very inspiring. I mean, just talking about, there's just so much we don't even know about the world of health. Like it's just a small group that realizes the incredible potential for children with Down syndrome or other genetic or chromosomal disorders. Alzheimer's, typically people have just been written off. Oh, I'm sorry, you've got that. But there is, you're right, fantastic and amazing things that can be done for that. So it's really very inspiring if you sort of, drop those expectations, think outside the box, what can be found for all conditions, really, isn't it?
Yeah, thinking outside the box for sure. I'll have new parents come to me, and I do. We don't just dive right into history, but I ask them. I do a good check-in. How you guys doing, right? And then, what do you know about this condition? What are your thoughts? And I've had some parents who literally say, well, I know to expect that they won't learn, and I know to expect this and all these negative things. And I just tell them, I say, erase all that. I'm not giving any false hope. I'm not telling people that, their child will achieve a PhD, will go on to do great things. I don't know. We don't know what any of our children will go on to do. Mm-hmm. But at the same time, I want to erase any negative expectations. I mean, those are so unhelpful. And so, right. And so I would hope that the medical community would do the same someday. But yeah, with any condition like Alzheimer's, with what research and functional medicine is showing us is that we need to erase all of those negative expectations that anyone has for Alzheimer's, Down syndrome, any neurodegenerative condition. There is a sense of hope for sure. There is a lot that can be done. Yeah.
And like you said, addressing all of these different things, not only is my eldest child thriving, but my other child is thriving too, my neurotypical child, to call it. They're just both doing great. So your diet, lifestyle, exercise, dropping those low expectations, setting your own high ones. I mean, he's blitzed all expectations, as I know your son has as well, and so many other kids in this community. So yeah, setting your own expectations is such a powerful thing, and not listening to the others. Yeah.
And to go a little further there, I often wonder, to go a little bit into beyond just biochemistry, like what kind of energy does that put out, to a child when you do have this kind of these expectations and these thoughts and feelings about it? What is that? What is that subconsciously doing to the child? I mean, everyone thinks like, oh, of course I'm going to, do my best to include my son in school and to, teach them math and do my best to, but if somewhere, you were told early on to expect these negative things and that's still within you, subconsciously that can still play a big role in ways, because it's subconscious, that we don't know. So I think that, boy, doctors play a big role in what I call setting the tone, right? When they're delivering a diagnosis. Now I'm speaking more to doctors, and I know your viewers are more parents, but if you've had a doctor tell you, I'm sorry, your child has this, here's what you expect, really do your best to erase all that and have a clear, unwritten future for your child. Nobody can tell you what your child's future is like, whether it's good or bad. And so to really keep your expectations high. Yeah, absolutely. Yeah, goes a long way.
Yeah, just to tie up, you might be able to remember the source. I can't remember the source. It's on one of those wonderful Down syndrome web pages. And it was talking about, well, if you get told, you get handed this little baby, and you get told at birth that this child's going to be a genius, this child's a genius, then, you take the child home and you're like, oh my goodness, what do? We play the Mozart, and, we start to get the accelerated learning stuff, and we get it all going. Great diet. Wow, we're raising the new little genius here. But if you get told, oh, I'm sorry, your child, probably never speak, probably never be able to live independently, never be able to do this or that, you're like, oh. And I've certainly known parents who have put a lot more time and effort into their other kids, but because their child with Down syndrome isn't expected to go as high, they don't give them those opportunities. So definitely those sort of expectations, they set the stage right from the start. So they can be very, very damaging. And what's worse is that they're actually incorrect.
Right. Yeah, they are absolutely incorrect. Yeah. So when we have families come to see us, and we kind of teach these ideas, and we, when my expectations are higher for a child, then I'm more able to see that when they are unwell, right? If my expectations, for a child who comes into my office who is maybe 4 and not walking yet, I know that that's not Down. I'm looking at my door as though a child is coming in. I know that's not Down syndrome, right? If a child is 4 and not yet walking, you know, that's something else. But because the parent's expectation is like, well, they have Down syndrome, they're 4, of course they're not walking. But I say, no, 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 something else is going on here, and we dig, and we find stuff often, right? Yeah, so if we get that, and that's where that erasing those negative expectations helps you see that, like, oh, there's actually kind of a problem here, right? And so yeah, so it makes our job really fun in many ways. Yeah, yeah.
It does. So to tie up, essentially, it's diet, lifestyle, exercise, supplements, looking at the child as a whole, and keeping those expectations high. It's essentially a good formula for success is what I'm hearing here.
Yeah. And hold those doctors, you know, to push them a little bit more, right? If they won't, you know, test something on your child, and in your gut, you know that like something is beyond, something's going wrong here, and your doctor won't help you, find another doctor, find somebody who will, and who will do a little bit more testing, and who will believe you, and, you know, and help. So yeah.
That's right. Don't get talked down by the first doctor that gives you the look for being one of those parents. Keep going, because it's your child. You're your child's best advocate, and I'm so glad there's doctors like you out there, Dr. Peirson. I mean, how wonderful. So thank you so much for what you do and for your clinic. Can you just tell us a little bit about where people can find you, or and we'll end there. Thank you.
Yeah, our website is PeirsonCenter.com. Peirson is spelled Peirson, PeirsonCenter.com. We're in Portland, Oregon, but we do, just like you and I are speaking here today, we do see families all over the world, which is really fun. We have patients in Asia and Australia and Dubai, and, you know, many other countries in Europe. And so we help patients over telemedicine, as well as in the office. It's really a fun day when we get patients in the office. And so, yeah, but we're located in Portland, Oregon. Yeah.
And it's not just Down syndrome. You actually focus on a range of syndromes now as well. Is that right? Can you just touch on that briefly?
We do. Yeah, I certainly started out specializing in helping children with Down syndrome, but we help children with autism as well, and then with other genetic conditions, using this same concept of, okay, so they have whatever genetic something going on. We look beyond, we look, you know, in-depth labs, functional tests to see how their body is functioning, you know, despite having this, you know, extra genetics, whatever going on. And so, so we do help other genetic conditions, and we do our best to to avoid diagnostic overshadowing. Yeah.
Well, that is just wonderful. So thank you so much for being with us here today and sharing this amazing and just wonderful information. I hope that the people who need it can find it. And just thank you so much for being with us today, Dr. Peirson.
Thanks for the opportunity, Melissa. Thank you.